So let's talk about route of administration. So route of administration is the pathway of a drug that's given to give you therapeutic effects. Okay. So the route of administration is determined mainly by property of the drugs. Okay, for example, whether they are water or lipid solubility, and also therapeutic objective. For example, drugs that you are going to treat for your eyes, then you will make it into eye drops. And if you want fast action, perhaps you need injection, and etc. Okay, there are three major routes of drug administration include enteral, which means oral, alright. Parenteral means non-oral, alright, and topical, okay, go through the skin, alright. Okay, this figure illustrates the subcategories of this route as well as the method of drug administration. So we have sublingual, the one that you put under the tongue. Inhalation, you inhale the drugs into your airway specifically for the delivery to the lung. Oral, okay. Transdermal patch, rectal delivery that you make into suppository, okay. Topical delivery, and injection. So what is the main difference between topical and transdermal? So topical, you apply your drug onto skin for local effect, alright. However, for transdermal, okay, you apply the drug, okay, on your dermis, okay, in order to pass through your skin, okay, go into systemic, means they are intended for going into the blood. Okay, so let's look at different route of administration. So we have enteral, means the oral route, okay, or sublingual. And oral can be further divided into enteric coated or extended release, means you prolong the release. Enteric coated means your drugs that you coat, okay, you coat with a certain material that they can withstand your harsh gastric condition, right? Okay, and when we talk about parenteral, you have IV infusion, intravenous infusion, you have subcutaneous, right? And other will be inhalation for lung delivery of the drugs, nasal inhalation, either for local effect into your airway, intrathecal, intraventricular, the one going into your brain system, topical and transdermal, as I have mentioned just now, or rectal, usually is for both local and systemic effects. In enteral administration, the drug is given through the mouth, okay. It is safe, common, convenient, and most economic way of drug administrations, okay. Through enteral, when you put your drug under the tongue, you can swallow. If it is oral, if you put it under the tongue, it is sublingual, that facilitate the direct absorption of the drugs into the bloodstream, for example GTN. When the drug is given orally, it is easy for self-administration as compared to an injection where you need a trained personnel, for example nurses and doctor. Also, it has a low risk of systemic infections, and moreover, the toxicity and also overdose caused by the oral route can be reversible by using antidote or activated charcoal. Alright. However, despite the ease of self-administration, the pathway for oral route is the one that is most complicated. This is due to the low pH of the stomach, which they can inactivate most of the drugs. Okay. A wide range of oral preparation is available, including enteric coated and extended release preparations. So talking about enteric coated preparation, enteric coated is a chemical envelope. Okay, let's say you have drugs. Let you put an envelope in, okay, to resist the action of the fluid and enzyme in the gastric. Okay. Okay, but they can dissolve very easily when they reach a higher pH. Okay, such coating is very useful for drug that is acid unstable, for example, omeprazole. Alright, enteric coated also protect the drug from stomach acid and deliver them instead to the less acidic intestine, where this coating material dissolve and allow the drug to be released. The same thing happen the drugs that have an irritant effects to the stomach, okay, such as aspirin, they can be coated with a substance that will dissolve only in the small intestine for absorption. Okay, because if aspirin dissolve in the stomach, they will cause irritations to the stomach. Extended release preparations can also be used in oral administration routes. Okay, and they have a special coating usually that control the speed of the drug being released. And if you have an extended release preparation, usually that they have a longer duration of action, that they improve patient compliance, okay, because patient just need to take maybe once daily but not too frequent. Okay, and also they may maintain the concentration of drug within a range that is suitable for therapeutic effects, unlike an immediate release dosage form. If you have an immediate release dosage form and you take the drugs in your blood, you increase the drug concentration and very quickly they gone down for elimination due to the short half-life. Okay, and if you have an extended release preparation, so the extended release, they will maintain the drugs concentration before they gone down. Okay, so as mentioned in the previous slide, so extended release preparation is very useful for short half-life drugs. For example, morphine, they have a half-life of 2 to 4 hours in adult, so it must be administered 6 times a day to obtain continuous analgesic effects. However, when you use an extended release preparation, only 2 doses are needed daily. However, many of the extended release formulation, they are developed due to marketing purpose rather than because of clinical advantages. So through sublingual route, it is a placement of the drug under the tongue that allow the drug to diffuse in the capillary network and therefore enter the systemic circulation. So the final destination is the blood, which is systemic circulation. Okay, what are the advantages of sublingual administration? Because due to the high capillary network under the tongue, so they have a rapid absorption. It is very convenient for administration, and we have low incidence of infections. Okay, and we can bypass. Okay, we can bypass the harsh stomach condition. Okay, and we can also avoid the first pass metabolism of the drugs into the superior vena cava, which they will metabolize most of the drugs and become inactive. Okay, we can bypass this process. Okay, and we have also a buccal route, between the cheek and the gum, which is similar to the sublingual route. It is mainly due to the capillary network in the mouth. All right. So in parenteral route of administration, it means non-enteral. Okay, it introduces the drugs directly across the body barrier into systemic circulation, means into the blood, and distribute to oral tissue. Okay, parenteral administration is used for drugs that are poorly absorbed from the GI tract. Okay, for example, heparin agent that are unstable in GI. Okay, parenteral administration also used for treatment for patients which is unconscious because they cannot take it orally, they cannot swallow, and any circumstances that they need rapid onset of action. And in addition, this route have the highest bioavailability. Bioavailability means the drugs is 100% readily available in the blood for the tissue. So besides their parenteral administration, they provide the most control over the actual dose of drug delivered to the body. Because if you take it orally, maybe you have 70% absorptions for person A, and you have 50% absorption for another person. But if you give it intravenously or parenterally, you have most control over the actual dose that you want to deliver to the body. However, this administration, one of the major advantage, they are irreversible, and they may cause pain, fear, local tissue damage, and also infection when you reuse the needles. Okay, there are three main major parenteral routes, which is intravenous, which is IV. Okay, intramuscular, that you go into the muscle, and subcutaneous, that you usually introduce the drug into the fat tissue. Okay, each route has their advantages and drawbacks. Intravenous injection is the most common parenteral route. For drug usually that is not absorbed orally, for example neuromuscular blocker, atrocurium, usually we have no other choice. Okay, IV delivery permits a rapid effect and a maximum degree of control over circulation level of drugs. When a drug injected as a bolus, the full amount of drug is delivered to the systemic circulation almost immediately. Okay, and the same dose may also be given as an infusion over a longer time frame. This will result in decrease in the peak plasma concentration. However, it will also result an increase in the time that the drug is present in the circulation. For example, if you have the IV infusion bolus, so you have the peak plasma achieved very quickly, but they may also drop quickly. But if you have an infusion, so it achieves slowly, however, it may maintain longer in the blood concentration. From there, you may have a longer effects. So IV injection is also advantageous for drugs that may cause irritation when they administered through the other routes, because the substance, if they inject IV, they can be rapidly diluted by the blood. Okay. So however, what are the disadvantages of IV infusion? First, it cannot be recalled, so it is not reversible. Okay, it may unintentionally introduce bacteria and other infective particles to the site of injections. Okay, it may also precipitate blood constituents, which can induce hemolysis or cause other adverse reaction because of too rapid delivery of the drugs in the plasma. Therefore, patients must be very carefully monitored for the unfavorable reaction of the drugs, and the rate of infusion must be carefully controlled. Another type of parenteral route is intramuscular. The drug can be administered in either aqueous, where you need a rapid effects, or in any specialized depot preparation which they can be absorbed slowly. In depot preparation, usually they consist of suspensions, okay, in non-aqueous vehicles such as PEG, polyethylene glycol. So when you have the drugs, okay, and the polyethylene glycol being injected into the muscular, the drug, the vehicle, once they reach your muscle, okay, they will dissolve and slowly diffuse out from the muscle, okay, and you will have the drug precipitate at the site of the action, which is the muscle, okay. Then they will release the drugs slowly into your bloodstream, okay. So the drug then dissolves slowly, provide a sustained dose over extended period of time. So one of the example are haloperidol or medroxyprogesterone, and this drug produce extended neuroleptic and contraceptive effects. So the one that produce neuroleptic is haloperidol, neuroleptics, and the medroxyprogesterone, they produce contraceptive effects. So this is the schematic diagram that shows where the drugs being administered. If you give it in IM, intramuscularly, so it will inject to the muscle, and if you give it your drugs in a subcutaneous injection, then they should go into the subcutaneous tissue. And the diagram B compare the intravenous administration of drugs to the intramuscular administration of drugs. So intravenous, if they are given bolus, okay, they usually will achieve the drug concentration very quick, okay, and maximum very quick. And when you have intramuscular, because of the extended release of the depot preparation, so usually you will have the lower maximum, but you will have the drug concentration at the maintained in the body for a longer time. So whereas for subcutaneous route, this route of administration, they are like IM injection. They require absorption via simple diffusion, and somewhat they are slower than the IV route. Okay, they can minimize the risk of hemolysis or thrombosis associated with the IV injection, and they can provide constant flow, a constant, slow, and sustained effect. Okay, this route should not also be used with drugs that can cause tissue irritation, because they can cause severe pain and they cause necrosis. Okay, these are the disadvantages. Okay, and sometimes the minute amount of epinephrine, okay, given with some other drugs, okay, so to restrict the area of action. For example, epinephrine act as a local vasoconstrictor, and they are given together with lidocaine to decrease the removal of drugs, okay, from the site of action. Let's say you give this epinephrine with lidocaine. So epinephrine, they vasoconstrict, right? So you have the less drug flow, so the removal of the drug from the site of action, from the site of administration, will be reduced. Then you will restrict the action of the drug at the area. So other example of drug that is given through subcutaneous include some solid that you can put in the subcutaneous tissue, such as the single rod, okay, a single rod containing ethanol gestrel, okay, a type of contraceptive. Okay, so the female patient no need to take the contraceptive pill every day, but they can just have this rod implant, and they can prevent pregnancy. Okay, and other example are programmable mechanical pump, okay, that can be implanted to deliver insulin for diabetic patient. As you know, insulin, they need to take it also injection. They usually self-injection daily. Okay, if you have a programmable pump, then they can pump the insulin when necessary, so the patient no need to take every day. So other route of administration include oral inhalation. So inhalation route, both oral or nasal, okay, they can provide rapid delivery of a drug across the large surface area of mucous membrane of the respiratory tract and pulmonary epithelium, and produce effect almost as rapid as the IV dose. So they are same as IV. Okay, and this route of administration usually used for drugs that are gases, or they can be dispersed in the aerosol. Okay, and it is very particularly effective. Okay, the second advantage, effective, and the third advantage, and it is very convenient for patient with respiratory complaint. Okay, because the drug can be delivered directly to the site of action. Okay, so the fourth advantages, okay, and thereby minimizing the systemic side effect. This is also one of the advantages. So example of drug that administered via this route include albuterol, corticosteroid, fluticasone. Other than that, we have also nasal inhalation, which involve administration of drug directly into the nose. So agents of nasal inhalation such as oxymetazoline or any anti-inflammatory corticosteroid such as mometasone furoate. Okay, desmopressin is also administered intranasally in the treatment of diabetes insipidus. Okay, salmon calcitonin is another example. This first example, this is another example. A peptide hormone used in the treatment of osteoporosis, also available as nasal spray. In our brain, we have what you call a blood-brain barrier. Typically, they are delaying or prevent any foreigners object into the central nervous system. So, but when you need a local rapid effect to enter the brain, okay, the drugs shall be introduced directly into the cerebrospinal fluid. For example, intrathecal administration. You can have intrathecal administration of amphotericin B and antifungal drugs used for treating cryptococcal meningitis. Let's look into the topical administration. Topical application is used when a local effect is needed. Okay, for example, you have clotrimazole applied as a cream directly on the skin when we need to treat a fungal disease of the skin, for example, dermatophytosis. Okay, and other than that, we can apply the drugs topically for transdermal effects. This route of administration achieve systemic effect, means they enter into the blood and available for tissue all over the body. Okay, so you apply the drug to the skin, usually via transdermal patch. Okay, and the rate of absorption can change, can be very different depending on physical characteristic of the skin of the person, okay, as well as lipid solubility of the drugs. So it depends on the skin of the person, okay, and where you apply the drugs. For example, on your palm or on the skin, or is it behind your ears? Okay, the skin characteristic of the site of application is very important, and as well as the drug solubility, physical characteristic of the drug. So the drug need to be lipophilic enough to cross the membrane. Okay, this route is most often used for the sustained release delivery of drugs such as anti-angina drug for nitroglycerin, the antiemetic scopolamine, or nicotine transdermal patch that has been used for smoking cessation, to stop smoking. Okay, this is a schematic diagram of a transdermal patch. Okay, so when you have your patch, put it onto your skin, and you will generate a concentration gradient from outside the skin to the blood vessel, and your drug will come into the blood vessel and carry systemically. Okay, they diffuse from the reservoir into subcutaneous tissue, then go into the blood systematically. Okay, externally this is how it look like. So let's just look at the last route of administration, which is rectal. So what are the advantages of rectals? As 50% of the drainage of rectal region bypass the portal circulation, mean they bypass the liver metabolism. Okay, so the biotransformation of the drug by the liver. So what are the biotransformation? For example, metabolism, okay, inactivation of the liver conjugation, okay, is minimized if we give a drugs through rectal administrations. So like the sublingual route of administration, the rectal route has additional advantage of preventing destruction of the drugs by the intestinal enzyme or by a low pH in the stomach. So they will prevent the drug degradation in intestinal enzyme and also by the low pH in the stomach. And this route is also useful if the drug induce vomiting when given orally. So if the patient already vomiting, if you give any drugs, they will still vomit the drug, so the drug become inactive. So if in this case you can choose the rectal route, okay, or it can also be used for patient who is unconscious. Okay, and the rectal route is commonly used to administer antiemetic drugs. Okay, however, the rectal absorption is often erratic and incomplete, and many drugs irritate the mucosa of the rectal. So they are erratic, means they are non-stable, so we don't know the amount of drugs, so the percentage of drug absorbed is not consistent, and the absorption may be not complete. Alright, so here we end the introductions to route of administration. So this slide summarizes the route of administration and some description about the absorption pattern, the advantages and disadvantages. This is what all you need to know from here.